How is arthritis like ice? This is Q&A with Dr. J, and I'm going to take a crack at it. Let me share with you this. From an ideal posture, there's minimal pressure on the joints of your neck, and we can measure that on an x-ray to see how close you are to ideal and how far away you may have transitioned through normal daily use. The biggest culprit of abnormal posture today affecting young children and adults is technology. Technology is new to our world and new to the human body, and for the first time in human evolution, we are changing our posture in a negative way on a daily basis. The pound of pressure on your neck is about 10 pounds, the weight of the head. Now, when your head migrates forward from looking down at a screen, the forces increase to as much as 60 pounds of pressure. Unfortunately, the delicate joints of your neck are not designed to carry 60 pounds. They're made to carry 10 pounds in a normal, upright, active posture. So over years and years of daily use and poor posture and spine neglect, the weight of the head is going to deteriorate the health of the joints. Now, how does this relate to ice? Well, imagine this. On a warm winter day, you take a walk out across a pond, and on that sheet of ice, you start to hear the creaks and groans below you, and you fear as if you're going to fall in. What do? The answer to that equation is you're supposed to lay down on the ice and spread your body weight out. This then increases the surface area of which your body weight is pushing on and diminishes the pressure that the ice feels and hopefully will keep you dry. This is the same way that your bones respond to abnormal stress. Remember, they're only designed to carry a 10-pound head, and when you're constantly looking down and forward at a computer screen or a cell phone, the force on your neck raises by 6 times that amount. You can only imagine what that pressure is going to do over time, decade after decade, if you don't do anything to counterbalance that. So the only reaction that your joints can do to decrease the pressure that they feel is to increase the surface area of the joint. So over time, the surfaces of the bones become larger and bulkier and bigger. Essentially, your body is trying to grow that bone to decrease the pressure. Now, in the medical world, we call that process of bone growth degenerative disc disease, degenerative joint disease, or most commonly known as arthritis. The biggest misconception people have about arthritis is that it's normal. Your bones should wear away at a predictable rate the older you get, but that cannot be further than the truth. That is the biggest misconception people have, and it's in large part due to your posture, and more specifically, the poor, uncorrected posture that people neglect for years and years and years. There was a study done by a Scottish medical doctor named Francis Smith. He performed MRIs on 154 10-year-olds. Now, he wasn't looking for this, but during the process of his study, he found out that almost 10% of all those 10-year-old spines had spine degeneration beginning, and they didn't complain of neck pain yet. Furthermore, if you contrast that to a study done in 2015, it shows that nearly 40% of 20-year-olds have spine degeneration with no symptoms. Now, you're probably saying, well, what's the big deal? If you're not hurting, then what's the problem? The problem is that the process of degeneration is happening. It's kind of like having tooth decay or cavities. You don't feel the cavity happening, but then overnight, boom, that cavity can strike and you can have horrible tooth pain that needs correction. That's oftentimes what happens with spine problems. Rarely do I see patients come into the clinic complaining of neck pain or back pain because of an acute episode. Usually it's something that gradually develops for no apparent reason. They sleep wrong, wake up the next day, and now they have pain. Well, there's no good reason for that to develop, other than the fact that they've had horrible posture. They've paid no mind to it because they felt okay, and this process of degeneration has impaired their function so greatly that now it reaches a threshold of either biomechanical instability or joint damage that causes the pain to develop. So I urge everybody out there, if you don't know what your spine looks like, when are you going to find that out? We take great care of our teeth. We understand the importance of regular, routine dental hygiene. We go to get them checked routinely. We go to our doctors to have routine physicals before the school year. Our children get their eyes and their ears and everything evaluated to make sure how healthy it is. But as a society, we neglect our spines until the damage is there. That's like waiting to check your eyes until you go blind, or waiting to evaluate your hearing until you're deaf. There's a much better way to go about it. And by taking a simple x-ray and looking at measurements, you can identify the risk factors that you have for developing this chronic degenerative condition, which most likely will lead to pain down the road. I hope this Q&A was beneficial to you. If you have any questions or comments that you would like help on, please leave a comment below and I'd be happy to answer those questions for you. If you also found this beneficial, please share it with someone that you know and care about. Thanks again. This is Dr. J from LifeSpine Health Enhancement Center.